So, hello guys, I'm Dr. Shubham Agarwal, and today I'm going to tell you the most prevalent topic these days, that is our dengue, which has been spreading a lot these days. So, this topic will cover the basics of dengue and will let you know what are the pathophysiology and what are the phases, what is the classification, and what is the treatment, and what are the myths which are related to uh, the dengue patients. Okay, so we all know that it belongs to the Flavivirus family, and the mode of transmission, yeah, is Aedes aegypti, and it usually spreads through the stagnant water. Okay, so its incubation period is 4 to 10 days. So when you talk about the pathogenesis, so what is we are most afraid is of about the leak syndrome. So in a leak syndrome, there is a plasma leak which leads to a hemoconcentration. This hemoconcentration will lead to bleeding, and there will be a multiple organ involvements. So this bleeding has occurred because of thrombocytopenia, either due to a platelet dysfunction or due to a disseminated intravascular coagulation. So when there has been a plasma leak, we call it a severe dengue. Now, these days, the dengue is not classified as a dengue hemorrhagic or a dengue non-hemorrhagic fever. Nowadays, the WHO has changed its classification, and they have given a new criteria in which the dengue has been classified into a non-severe dengue and a severe dengue. So, in a non-severe dengue, we have the dengue which have without any warning signs and a dengue with a warning signs. So, what will be a dengue with without a warning sign, which is a probable dengue, which we usually see if you are traveling to some endemic area, if there is a fever and any two symptoms out of the six symptoms are involved. There's a nausea, vomiting, rash, usually a maculopapular rash. There's a body aches. There's a tourniquet test positive. What is this tourniquet test? You inflate the BP cuff to 80 mm, and then you see the spots. Okay, and if these spots have a particular value, if these are more than that, that means it is tourniquet test positive, which we will be discussing now. And there will be an earlier symptom, that is a leukopenia, or there's some warning symptoms. Now, which dengue patients you will call it as a diagnosed dengue patient or confirmed dengue patient? Either they have an NS1 antigen positive if the patient is presenting in first 5 days. So if the patient is presenting after 5 days, you have to go for IgM MAC ELISA antibody test. Okay. So what are the warning signs, which is very important? Usually the patient coming to you with abdominal pain, and we usually we say okay, it's just an abdominal pain, but no, it is a warning sign. Abdominal pain, okay, we all know that if there's a bleed, if there's a mucosal bleed, it is a warning sign. If there's a hepatomegaly in which the liver size has become more than 2 centimeter, again it's a warning sign. But we usually ignore the abdominal pain. We usually ignore the fluid accumulation or the persistent vomiting or a mucosal bleed. Okay, in investigation, if your hematocrit is constantly rising and your platelets are constantly falling, or there is an acute fall of platelets from lakhs, for example, if the patient has a 1.5 lakh of platelets and next day the patient is coming to you with a 30,000 of platelets, so why there is such a big gap? So to see this big gap, that means there has been a plasma leak. Now coming to a severe dengue, we have already told that when there's a plasma leak, it is a severe dengue. So if the fluid is going into the third space, okay, so the patient will develop a shock and will also develop a respiratory distress. Yeah, right. There will be a severe bleed in a obviously severe dengue. There will be several organs involved like a liver, heart, and CNS. So what happens is the patient of dengue usually come to you with a raised ALT, AST, raised kidney functions, raised creatinine, and usually an altered sensorium. So usually the patient diagnose it as okay, you have a hepatitis. Okay, it is a hepatitis, but it is a dengue-induced hepatitis. It is not a liver injury which has occurred because of some medicine or because of some alcohol. Yes, that might play a role, but do not do not treat him on the basis of ALI. Do not treat him on the basis of giving a Rifagot or giving a UDX. That is nonsense treatment, because you have to you have to control the source. You have to see the cause, that here it's a dengue is the cause. So the AST and ALT can be 2 to 3 times higher. That doesn't mean that the patient has a hepatitis. Okay, that is a it's a severe hepatitis. It is basically due to a fluid deficit. It is due to a third space leak. Okay, now there's a new term these days which is known as a expanded dengue. So what happens in the expanded dengue is either you can have a hemorrhage or otherwise you can have a coagulation. So anything can happen. So there can be a cerebrovascular infarction, there can be a cortical vein thrombosis, and there can be a myocardial infarction. So do not ignore these symptoms. These are very, very important things. And then there's a co-infection. The co-infection can occur with the malaria, it can occur with the scrub typhus, leptospira, enteric fever, COVID, chikungunya. Okay. So what are the high risk dengue? Usually the extremes of age, like infants and geriatric age group, pediatric patient having some comorbidity of hypertension, IHD, or hemoglobin abnormality, and an immunocompromised state. Okay. So the next thing that we need to see is what was the old classification. The old classification is also very much helpful, but this is not being followed these days because the criteria has come. Okay, because these involve more of the laboratory criterias, but now we are more diagnosing the things on a clinical basis, because lab investigations do take time. There can be a, if the platelets, the vial has diluted, so the results can be wrong. So do not rely on that, but yes, this is very important to know. So the first classification is a dengue fever with two symptoms out of the seven symptoms: same headache, retroorbital pain, arthralgia, myalgia, rash, hemorrhage, and there is no evidence of leak. Basically there is no shock. So the first and the foremost symptom you will see is a leukopenia. TLC will reduce to less than 5,000. There will be reduced platelets less than 1.5 lakhs, and there will be increased hematocrit 5 to 10%. Basically, if the patient is having 26.7, so there will be a 10% increase. Okay, not much. 2 2.6 का increase हुआ, so that is not a very high increase. Now coming to the dengue hemorrhagic fever, they have the four grades: grade 1, 2, 3, and 4. 3 and 4 together we call it a dengue shock syndrome. So first of all, let's talk about grade 1. There will be a fever and there will be a hemorrhage, but a mild hemorrhage, not a lot of hemorrhage, but plus there will be evidence of leak. Now your platelets will fall to less than 1 lakh and your hematocrit will rise more than 20%. So if it is 30, 20% will rise, so there will be a great rise in that. It is not a small rise, it is a bigger rise. Okay, if it is 30, so you have a 6, it will become 36, so that is a significant higher increase. Okay, in grade 2 there will be a spontaneous bleed, there can be a nasal bleed, there can be a conjunctival hemorrhage, there can be a hematemesis, there can be a brushing the teeth, there can be a bleed, there can be a hematemesis, hematochezia, menorrhagia. So platelets will fall to less than 1 lakh and your hematocrit will rise more than 20%. The third grade is the grade in which there's a features of heart failure. Basically your BP will fall, your pulse will be, basically the patient is going towards shock, so you have to prevent the patient from going towards shock. Okay, again the same criteria for the platelets and hematocrit. And then you have a grade 4, patient went into shock, the BP and the pulse went undetectable. Okay, so avoid the grade 3 and 4. They are very severe. Even in a very good clinics, these things people do get, degrade. So what are the phases of dengue? We'll go a little fast because we want to basically focus on the treatment. So we have a febrile phase, then we have a critical phase, and then we have a recovery phase. So what happens in the febrile phase? In this, the patient is dehydrated. The patient will usually come to you I have a fever for 2 to 7 days. There will be a facial flushing. There will be intense backache. There will be intense myalgia. The patient will come to you with a headache, retroorbital pain, macular papular rash. There will be a tender hepatomegaly, and might be there's a seizures in the young. So the earlier sign I've already told you, there will be a leukopenia. And yes, I was talking of a tourniquet test. आपने BP cuff बांधा, you tied the BP cuff, you inflated it to 80 mm, you have to wait for 5 minutes. So if below the 5 centimeter, 5 centimeter, like if you have inflated hair 5 centimeter below the BP cuff, if you see more than 20 petiki, that means your tourniquet test is positive. This is very essential in the resource limited setting. For example, if you are sitting in a dispensary or you are sitting in a PHC and you know the CBC report is still awaited, it will take 4 hours. You can do the simple test. You tie a tourniquet, see 5 centimeter below it. You will, if you see more than 20 petechial rashes, that means the patient is in a febrile phase. Second is in a critical phase, it is known as a defervescence phase because the patient has started to go into a plasma leak, your hematocrit will start rising, there will be a third space fluid, there will be a pleural effusion, there will be ascites, patient is going into shock, though your temperature will start reducing, but other factors have started involving. You will have the organ impairment such as metabolic acidosis, you will have a DIC, hepatitis, encephalitis, myocarditis. So in this phase, it is very important to start your IV rehydration. We will see how we will do the IV rehydration, but just remember that you have to start from 2 to 3 ml per kg per hour. We'll discuss it further so that if you will go for overhydration, what will happen is if you will go for a overhydration, so your patient will go into the respiratory distress, there will be a pulmonary edema, and that will be a more of the severe condition. Then you have to give Lasix. You can't give Lasix because then the patient will go into dehydration state. So avoid this phase, this is very important. And then there's a recovery phase in which there's a hypervolemia, there's a gradual reabsorption of a fluid from the extracellular space. So it is very important that you do not overhydrate the patient in this phase, and you stop the IV fluids and you start tell the patient to take the oral fluids more. Okay, so improved well-being, there's a diuresis, there's improved hemodynamics, BP is coming into range. Okay, there's an improvement of GI symptoms, there's an improved appetite. So in this phase you will see that his body will be red and you will have a white spots. So it's called isles of white in the sea of red. So patient will say, "Arey, something is happening to me." Okay, see what this is happening. So just don't start the patients on anti-allergics or anything like that because that won't help. The patient is recovering and there's nothing to worry about it. Okay, so patient might have a bradycardia. So there are few conditions where the patient have a relative bradycardia like malaria, typhoid, leptospirosis, uh, chikungunya, and your this dengue. Okay, hematocrit will start to stabilize your WBC. So first you have seen that the leukopenia is happening. So अगर leukopenia पहले हुआ है तो WBC will rise before, and after that your platelets will start rising. So yeah, now, what are the investigations you should go for a dengue? So, their basic CBC will give you a lot of information of leukopenia, thrombocytopenia, raised hematocrit, raised AST to ALT. It can be more than 1000. So, do not confuse it with what your hepatitis. And hemoglobin will usually rise because of hemoconcentration. So, you go for a tissue culture, not done these days, RT-PCR. NS1 antigen is very specific, but in the first 5 days. After that, you have to go for IgM, macrolizer, IgG antibodies. If it is a severe dengue, you are developing effusions, you are developing ascites, must go for X-ray and abdominal ultrasound. Okay, so let's go to the next slide. Yeah. So this slide is very important, that how you will manage your dengue patients, which is usually not done properly, and your patients either deteriorate or they do not know, even the physicians do not know when to administer what, and the patient starts deteriorating. So it is very important that first of all history, physical examination, everything is very important. So in a history you will ask the patient, तुम्हारा fever कब start हुआ, date of onset of fever, because from there you will decide that you will go for the NS1 antigen or the IgM macrolizer. Why? Because you know your both the tests are very costly, 800, 1600. So you do not want to patient to undergo such a heavy economical burden. So quantity of oral intake very important. Tell the patient to take a lot of fluids orally, 3 to 4 liter, 1 liter की bottle उनको दिखाओ, and tell them to drink 4 bottles a day. And if he's saying कि मेरे को vomiting आ रहा है and everything is happening, tell them at least drink the water, take the fluid in other form. You can take the ORS form, you can take the fruits, and not very fancy fruits, just the normal fruits can be taken, and he will eventually improve. What are the warning signs? We have already seen abdominal pain, vomiting, mucosal bleed, there's some tenderness, there's a hepatomegaly. These are the warning signs. Diarrhea is there, and a change in mental status, because that means your organ have started involving and the patient is going into altered sensory. Again, the urine will be the most important. Urine output, frequency, time of the last void, because if your urine output will increase, so what will happen that if your urine output has increased and come to the normal, that means the patient could be discharged, right? And any comorbid condition, because that will become the factor of co-infection. Investigation, we have seen CBC, hematocrit, LFT, RFT, serum glucose, serum electrolytes, because you cannot injudicious use of fluids if there will be. So your sodium and potassium are definitely going up and down, and the patient can go into dysarrhythmias, patient can go into altered sensorium. So always go for serum electrolytes. ECG to see the changes of electrolyte, are they genuine or not. Cardiac enzymes, so to rule out any MI if the patient has gone into such a phase of hypercoagulable state. ECG, you have to go for urine. Now, just similar to the COVID, in this also there are some poor prognostic markers. Okay, similarly, because patient is going into the third space leak, so your albumin will fall, serum ferritin will increase because it is a positive predictor of any type of infection, of viral infection specifically, and your CRP will increase. So patient usually come to us that CRP बढ़ गया है, what to do, they will panic. So you have to counsel them properly that okay, this is a line of treatment, बहुत सारी medications नहीं लेनी है, ठीक है. Now then you have to go out for a diagnostic which the patient determine whether it is dengue or not. आपने NS1 antigen और IgM करवा के देख लिया, done. Then you have to see that the patient either is in a febrile phase or in a critical phase or it is in a recovery phase. Warning signs हैं या नहीं है, dehydrated है, hemodynamics देखने हैं. And yes, very important, because patient coming to you with the 90,000 platelets and you are admitting them is a burden on the society, because the patient who needs a bed will not get the bed. So when to tell the patient that home management is must, such as in COVID. Then you have a management, very important. Now we have a group A. Group A वो है जो home पे manage हो जाएंगे, जिनके platelets are in lakhs or they are more than 50,000. There are no warning signs, there is no dehydration, BP like vital signs are in a normal limit. So you have to give them a oral fluids. Irrespective they say हमें medications दो, ये करो, I will no. This is your judicious practice and your clinical thinking that okay, no, you can be managed at home and very very well managed at home. Okay, so are you urinating every 6 hourly? Yes. There are no warning signs, so you have to go for fluids like ORS or juice or fruits. And fever के लिए you have to give a simple paracetamol that will do wonders. And you have to avoid NSAIDs and aspirin because they can become a reason of a bleed. And tapered sponge, it do helps. We have seen in the clinical practice. Now group B is a patient in which the warning signs have started coming, and here the importance of hematocrit comes. So you have to look at the hematocrit, you have to look at the platelets. Crystalloids, we all know, is a solution of choice. You can give NS, you can give RL. So start from 5 to 7 ml per kg. So if the patient is of 60 kg, 16 into 5, 300 ml you have to give for 1 to 2 hours. So you have a 500 ml ka bottle. To to tell your staff to give 2 bottles for first 1 hour. Okay, then reduce आधा कर दो, then give 1 bottle in the third hour and fourth hour, and then you have to give a 1 bottle in 2 hours. So कैसे हो गया? 2 bottles in the first hour, okay, run. Then you have to give 2 bottles in another 2 hours, then 1 bottle in 1 hour. So this is how you follow. So remember 5 to 7, and then you have to do 3 to 5 and 2 to 3. This is how you give. Now what you have seen that hematocrit is still the same, it hasn't improved. So just give 2 to 3 ml per kg for next 2 to 4 hours. Now if the hematocrit is rising, you have to increase your fluid so that patient does not go into a hemoconcentration or plasma leak ना हो. तो अपने 5 to 10 ml per kg per hour कर दिया. And you have to repeat all the tests. You have to repeat hematocrit, you have to repeat platelets. Now coming to I'll this is very very important thing. This thing is a very important thing, that how you will go from 5 to 7 ml per kg. This is a routine, you will develop this routine slowly, but it is very important. 5 to 7, 3 to 5, 2 to 3. Okay, now coming to the third case where the patient has a, if you are in a small unit, you have to refer the patient, so here it will help. Okay, so in this, there is a plasma leak, hemorrhage, the patient is going into encephalopathy, hepatitis, cardiomyopathy, or a renal disease. In this, you cannot give injudicious IV fluids. You have to be very specific what you are giving. So you have to go for the isotonic crystalloids, but okay, you can give a colloid albumin. You can start in these patient. Now, if the patient have developed a shock, so yes, you have your fluids will be at 5 to 10 ml per kg per hour. If still he is not improving, you have to add vasopressors, you have to increase the infusion rate, you have to add inotropes such as noradrenaline and dopamine, but stick to noradrenaline. After that, we'll see to go to dopamine. Now, patient have developed dopamine, the patient has developed a hemorrhage. So, what you have to write it on a file, bada bada, that no one give any IM injection because patient can bleed. Second, if the patient is still complaining of pain, never give NSAIDs, no Brufen, no Diclo, no aspirin, no anticoagulants. Two warnings. You have to write a big no IM, no IM injection. Then you have to write no Diclo, ibuprofen, aspirin, and anticoagulants. Now, if the platelets have reduced to less than 10,000, then only go for a platelet infusion in the form of RDP or SDP. Okay, if the patient gets go into a coagulopathy, you have to infuse the plasma. If the patient has a HB less than 8 gram per deciliter, go for PRBC. And if the patient has gone into hemophagocytosis, if you can see, then only give steroids. Steroid does not have much of the role. I've seen people giving steroids like anything and a patient deteriorating because already he's in a leukopenic state, so he will develop a co-infection if you will give a lot of steroids. So be very careful while giving it. And I hope this discussion would have helped you, and you can ask your queries in the doubt. Yeah, thank you.